Hello friends, today we are going to talk about treatment of fevers in respect of Organon of Medicine. Yes, Hahnemann has given a lot of guidelines about how to treat fevers. Most of these guidelines are in aphorism number 231 to 244, which relate to treatment of intermittent diseases. Many homeopaths feel that these aphorisms relate only to the treatment of intermittent fevers, like malaria. But Hahnemann has classified intermittent fevers in two different categories. One category where the intermittent fever is endemic to marshy districts, which is very similar to malaria, and in other cases where the intermittent fever is sporadic, and this includes all kinds of fevers, because intermittent fever has not just periodicity but also has distinct phases of heat, sweat and chill. Now, it's not just that the malaria has these stages. All viral fevers have these stages. Urinary tract infections have these stages. Acute infections like pharyngitis have these stages. Even septicemia has these stages. So, the guidelines to treat all these viral and bacterial infections also are given in these aphorisms, specifically in aphorism number 235 and 236. And what does he say there? What does Hahnemann say about selection of the remedy in treatment of all these different acute fevers? Hahnemann says that the remedy that you choose should ideally cover the whole picture of the fever. That means all the different stages, the heat, the chill, the sweat, all the three stages should be covered along with all the concomitant symptoms for the best results to come. However, Hahnemann says that it's often not possible to have an exact match of all the different stages. So in those cases, you should select a remedy which should match with the dominant stage of the fever. Like if the patient has a fever where there's a lot of chill, then your remedy should also have those chills. If your patient has a fever which has very high grade fever, then your remedy should have that kind of heat. And one very interesting thing that Hahnemann has said is, in treatment of fevers, it's not just the symptoms of the febrile stage that are important. Hahnemann says that the symptoms when the patient is afebrile, the symptoms between two episodes of fever, they are very, very important in treating the fevers which are intermittent, which are episodic, which comes in cycles. And because these remaining symptoms that are present during this phase of afebrile phase, they actually give the clue to how to break the cycle of fever. So this is what Hahnemann says about treatment of acute fevers. Now Hahnemann is also given guidelines about when to give the remedy. Your patient comes to you and you select a certain remedy. But when do you give that remedy? Do you give it during the febrile stage or the sweat stage or the chill stage? At what stage you should be giving the remedy to the patient? So Hahnemann says that ideally the remedy should be given when the patient is in the afebrile stage. That means in the cycle of fever, when the fever breaks, that is the best time to give the homeopathic remedy, because then the remedy have a very deep action without any significant aggravation. Because during the febrile stage, the patient is already in aggravated state. And Hahnemann wants to avoid any further aggravation of the state. So Hahnemann says, give the remedy during the afebrile stage, just when the fever has ended. However, Hahnemann, being a visionary that he was, foresaw that there are fevers where there is no clear cut afebrile stage. What happens is that the patient has got 102 fever, 103 fever. Now when the fever breaks, it's not afebrile state that comes. What comes is a fever which is 9900. The patient is not afebrile. So in those cases, Hahnemann says that if you have a patient like that, then the remedy should be given at the end of the sweat stage. So when the patient has started perspiring, when the patient has fever, do not give the remedy. When the patient has chills, do not give the remedy. When the patient has started sweating, do not give the remedy. When the sweating is starting to abate, that is the best time to give the remedy. So these are the guidelines for treatment of acute fevers as given in Organon of Medicine. And there is a lot more. If you want to understand these tips, these clinical tips from the Organon in more detail, please go and have a look at my book on Lectures on Organon of Medicine, which elaborates in very great detail and in modern language with modern examples all the concepts of the Organon of Medicine. So this is treatment of acute fevers as per Organon for you. Have a good day.